If you have acid reflux or you're taking a PPI medication, and that is a prescription medication to deal with your acid reflux, then I really want to have a frank discussion with you today. Because acid reflux is a very common complaint amongst Americans. Certainly PPI medications are one of the most commonly prescribed medications in the world. And kind of the simple concept is, oh, you have acid reflux and the Tums doesn't work anymore, meaning the over-the-counter solutions are no longer doing it for you. Then you seek out your doctor and he or she prescribes you a medication and everything is bright and shiny and the world is pretty again. Meaning that, yeah, your symptoms are handled, and there's just a lot more to it than that that I really want to get across to you. So let's first of all look at the issues of having acid reflux. So if you have it, you're aware of this. You can have pain in your chest, you can have bloating and gas, you can actually be tasting the bitter acid in your mouth. Sometimes you have trouble swallowing. It can get bad enough where people are regurgitating their food. Speaking of food, you're not enjoying your food because you're so irritated, and it feels like food is just not your friend anymore, which is terrible because obviously we need that to survive, and food is pleasurable, and it's no longer pleasurable. You have trouble lying flat at night, so it's interrupting your sleep. Maybe you're propping yourself up a little bit because the acid is regurgitating. And acid reflux can be a very miserable experience, not to mention the long-term issues with what the acid is doing to your esophagus, creating long-term issues there, and sometimes ulcers, and over the very long term, potentially cancer. So there's a lot that goes with acid reflux, and why, of course, we want to get rid of it. A big issue is how your heart and your esophagus and your stomach are all interrelated through a reflex. So you have the gastric meaning stomach reflex, and then you have the cardio-esophageal reflex. And really what both of them mean is that when one organ is irritated, it's creating irritation in the other. So you have the facts that you can have your stomach irritated and due to acid reflux, and then you're getting heart palpitations due to this. It's a neurological, so it's through the vagus nerve, this connection. And it really is an interplay or interconnectedness that happens with the esophagus and the heart and the stomach and the heart. And that leads us to one of the major things I wanted to talk about as far as your risk with acid reflux, which is that it's increasing your risk of not just atrial fibrillation, but also having a heart attack. And I'm sort of doing a deep dive into this area right now because there's just too many people that don't know about this, and there's too many people just taking these medications unwittingly. Now, some people, I think the lucky people, get on the PPI medication and they don't do well. And I'm saying they're lucky because their body has a poor reaction to it, which makes them hopefully find out what's really causing the acid reflux. We'll get into solutions later. But for some people, they've been on these for not just months, but years and decades. I regularly meet patients who've been on PPIs for decades, and they don't love the fact that they're, they have to take them or they'll be miserable. But otherwise, they handle their symptoms. So they're, to some degree, happily taking them. So we have these risks of acid reflux as far as the heart is concerned, the long-term effects of acid on the stomach, and just the misery of day-to-day life, feeling that way, and as I said, not enjoying your food, etc. So now let's go to what the solution is that you're offered, which is the PPI medication. Now, the dangers of PPIs, first of all, you should know that the Food and Drug Administration only approves PPI use for 2 weeks at a time. So that's the approved use. And so again, people are taking them for months, years, and decades. So no one, well, not no wonder, I guess, yes, no wonder, because all drugs have side effects. We're pretty aware of the fact that they all have side effects. But the side effects of PPIs are being kind of revealed over time, and they're pretty devastating. So we have infections that get created because you decrease the stomach acid. That's what the drug does. And that stomach acid is there for a reason. It's there to kill bad organisms. I mean, your stomach is producing, it's a bag of hydrochloric acid, and Mother Nature made it that way. So the little organisms that are contained in our food, you know, it's not that the food was dirty per se, they're just there. It's normal. But when that food with the bad organisms hits that bag of hydrochloric acid, they're killed. The bad guys are killed, and that was by design. But now you've really decreased the amount of acid in your stomach, and these bad guys propagate. They very happily multiply. So that can result in SIBO. It can result in what's called Dispiosis, which is imbalance of the good bacteria and bad bacteria in the colon, which then sets you up for a variety of inflammatory diseases. It affects your mood and your hormones. It affects your immune system. 70% of our immune system is housed in our gut. So, okay, so we have infections. Then we also have risk, this is risk of PPI. So risk of osteoporosis, brittle bones. Why? Because you're not absorbing your minerals because you need the acid in your stomach to absorb them. So now you're getting brittle bones. Kidney disease is another one associated with PPIs, and it's an insidious type of kidney disease because these are patients who have no prior history of issues with their kidney and then suddenly have a rather debilitating form of kidney disease. Dementia is another one, and they saw this in quite young candidates, and I'm going to be doing kind of a deep dive into the research with all the specifics of that. But the dementia research is truly scary. And then we knew about increased stroke, but recently I've been talking about the fact that increased risk of myocardial infarction, so having a heart attack with PPIs, and there have been a number of studies, and I've done recent videos, you can watch those, where I'm giving numbers, like, 126,000 people looked at over 9 years, and this risk is anywhere from 1.5 to 3.5 times increased risk. And these are not patients with a history of heart disease. They don't. And then there was another study with people with a history of heart disease. But I looked at both, and it was dramatic as far as increased risk of myocardial infarction. So now you've got heart issues from acid reflux, from that reflex between the heart and the esophagus, the heart and the stomach. Then you've got your solution, taking your PPI, which is again putting your heart at risk, plus all those other areas of your body that I just mentioned. Don't get depressed. There's an answer here. But sure, if you feel like, wow, rock and hard place, and I've been doing a few of these videos recently, and people were like, you're just giving me bad news. And it is bad news, but I never just give bad news. I'm always giving a solution, and understand that here at Root Cause, we've been doing this for 40 years. We've been specializing in hiatal hernia syndrome, let alone just overall gut health for, well, the gut health for 40 years, the whole time. Hiatal hernia syndrome closer to 30 years, but it really all comes down to gut health. And so what we find is that you really just need to, so here's solution, right? What we need to do is figure out why. In this case, we're talking about acid reflux, right? You're only given the PPI because you're miserable with the acid reflux. Why is that stomach being compressed? Why is it being compressed such that it has no choice but to bring that acid up your esophagus? It's a mechanical thing that's occurring. Now, what are some of the reasons? That's what we figure out. And I know sometimes people get frustrated because it's like, you didn't tell me what to do. And it's like, if there was one thing to tell you, I would tell you, I promise you, I want people to be happy and healthy and live their best lives. But I'm also not going to lie to you, and I'm not going to sugarcoat it, and I'm not going to give you some clickbait answer, because I hate that. Here at Root Cause, I mean, the name says it. That's what we're all about. It's getting to that underlying reason for you versus Bob versus Mary. You know, it's different for different people. But the types of things it can be, food sensitivities are definitely a common thing we run into. Also, having these infections, having the long-term infections in the colon, or SIBO, which is small intestinal bacterial overgrowth that's creating inflammation and increased pressure in the abdomen. Also, toxin exposure. We find mold, we find heavy metal, we find viral overloads. What else do I want to tell you about? Oh, then there's lifestyle, certainly, issues that people have where, you know, they overeat, they eat late at night, then they lie down, and you know, so there are things that can be over time aggravating the pressure in the abdomen, the stress on the stomach, etc. So there's lifestyle factors, and then there's also a structural or neurological aspect, and that's looking at your vagus nerve, which I mentioned earlier, along with your spine, your cervical spine, your neck. And because we talked about this reflex, right? The stomach, heart, esophagus, heart, reflex, that is controlled by your nervous system, which is your vagus nerve. And the vagus nerve comes out of your brain, but it travels down your neck on both sides. And so people can have issues with their neck, they can have issues with their vagus nerve that are really an integral part of what they're suffering from. And that's why I think our success rate is so high, because we're not only working internally with the gut and normalizing that and handling internal inflammation, but we're also working structurally with our patients in balancing muscle, nerve flow, etc. So it's that marriage of the two that really brings the success. So where are we? I understand if you've been on a PPI for quite some time and you go, oh, listen, I've tried to stop it, I'm miserable. I get that. So it's not about stopping it cold turkey, because what can happen is you can get a rebound where, you know, you've been suppressing the acid with, you know, on your stomach production for so long, and then you just stop it and the stomach goes, whoa, and just actually does produce too much acid, and then you can be really miserable. So there is a way to wean down and off. And of course, what we like to do here is figure out what's the cause and start working on that, the cause of that pressure, have it start diminishing, and we're sort of, you know, gradiently taking down the pressure and then also taking down the medication, and you do it very gently so you're not miserable. So there's that, in a nutshell, is what I wanted to review, and I wanted you to really know the effects, the side effects, the dangers. And heart disease is our #1 killer. It just is, and there's nothing even close. And the fact that having acid reflux increases your risk for heart issues, as well as being on a PPI, both, that, you know, it's time to take this seriously and say, okay, what's plan C? You know, we've got the reflux, we've got the drug. How do I fix this and not get stuck between I'm either miserable with acid reflux or I'm putting myself in danger taking a PPI? There is a third option, and that's what we do here, and we're more than happy to help you. But hopefully I've given you good perspective and just more knowledge in the area. By the way, if you like this information, please give the video a thumbs up. Consider subscribing to the channel. We want more people to be able to hear this information, see this information, and that's how it happens with more subscribers. So I'd love it if you do that, and please share this with people in your life who are taking antacids and suffer with acid reflux, suffer with digestive upset, because it's all intertwined. Okay, I'll talk to you soon.